Hi, my name is Matt Gosbell. I'm part owner here of the Melbourne Bird Veterinary Hospital. We're one of only 2 bird-only clinics in Australia. I've got what we call a membership in avian medicine, and I'm also presently doing a residency to become a registered bird specialist here in Australia. So this is Morgie. Morgie is a long-term client of mine. She's nearly about 40. And she's suffered from many different sort of diseases over her lifetime, but most of the problems that she's suffering from at the moment stem from a long-term fatty diet when she was younger. Fortunately, that diet has changed, but what it's done is it's caused fatty liver disease. The diet has been changed quite late in her life, so that's resulted in an ongoing system of problems. So it's now causing problems with her heart, and it's caused other problems considering her weight. She's got arthritis problems and other things as well. Fatty liver disease we see a lot of in these species of birds, so the Australian species especially, but all species of birds that are fed high-fat diets. The longer they've been fed these high-fat diets, what happens is the fat goes into the liver. The liver can't process that. When it's too much fat, the liver just stores more and more and more fat, and eventually it stores so much fat that the liver stops working properly. My usual term for it is pate liver. So this is how they make pate with ducks. They feed them very high-fat diets and they get pate. So the same thing happens with our birds, our pet parrots and things. A liver that feels and looks like pate is not going to be a liver that's going to be functioning very well. So a build-up of fat on the liver eventually means the liver doesn't function properly. So when you get a liver that's not functioning very well, you get a reduction in things like the proteins that they use for clotting. So what we sometimes find is we find little bruises and clots in their beaks in particular. We get problems with overgrown beaks. You often see it with very poor feathering, so you get poor quality feathering. Along with fatty liver disease, especially in these types of parrots, you'll often get fat depositing up around the skin and you'll get fatty lumps. I said poor feathering often leads to plucking. And sometimes we'll get plucking around the area where the liver is. So the liver will be poking out underneath the chest just here. If you've got some liver damage from fatty liver disease and it's causing some pain and discomfort to the bird, you'll find that they'll often pluck around in this area as well, and that's quite common as well. So a lot of our pet birds, especially birds that are fed mainly a seed-based diet, often become quite overweight and obese. And this can be a huge problem because, as we talked about with fatty liver disease, the fat needs to go somewhere and it's stored somewhere on the body. The more fat that they have on their diet, the higher the cholesterol, and that will also lead to things like atherosclerosis as well. So that will affect the heart. Birds that are overweight and not being exercised and are not on good nutrition. So Morgie here, as a result of a fatty liver disease, is also on a number of other medications secondary to the fatty liver disease. So the fatty liver disease has led on to heart disease. Being overweight has led on to arthritis issues. And as a result, she's on numerous medications for each of those different problems. Fatty liver disease is a slow, insidious disease as a result of a lifetime of fat. Morgie's very fortunate. She's now 40 years of age. Normally birds such as her that are on a seed diet are lucky to live past their 20s. So we see a lot of galahs dying at a far too younger age, and a lot of cockies and other species simply because they've been fed the wrong diet, and they are getting worse and worse with their health over time, and they're just not coping with the disease deficiencies and excess fat that's in their diet. I did have a client once who had a cockatiel that was on a fatty diet and ended up with fatty liver disease. This bird was so sick that simply a slight change in the diet resulted in this bird sort of dying within 5 days. So this bird, what happened with this bird, the owner ran out of the regular seed. She didn't manage to wean this bird off the seed diet completely, so what we ended up doing is getting as best quality seed as possible. She ran out of her seed and decided she'd just tide the bird over till she could get some new seed by getting some supermarket seed, and within 5 days the bird was dead. This is not a nice disease. It's a slow, insidious disease. You don't notice it when it starts. You just start seeing a bird that's fat, becomes less mobile. You might find some changes in the droppings, but even that is not in the early stages. What happens is it happens over years, and if it's caught early enough, it can be reversed. The liver is very, very forgiving and does have the ability to regenerate, but unlike Morgie, the unlucky thing with Morgie is that the liver and the damage that has been caused, there's some degree of it that's been irreversible, and it's led on to all these other secondary problems such as heart problems. But it can be very difficult to give some of these guys the multiple medications they need in order to maintain a quality of life. The best way to prevent dietary-related fatty liver disease is obviously to give diets low in fat. Giving correct diets and good exercise is what it's all about. Just like for us, it's our responsibility. The birds don't go out and get their own food, we get it for them. So it's our responsibility to make sure we're feeding our birds correctly. The seeds that we traditionally buy at the supermarkets and the pet shops, these are not the seeds that these guys naturally eat in the wild. So these are diets that we've made from seeds that are very high in fats and very low in essential vitamins and minerals that we're feeding our birds. And yes, they can survive for a period of time, but over that time they develop a whole lot of nutritional deficiencies as well as excess fat related diseases. Some of the different ways in which we monitor and manage fatty liver disease is through regular routine blood tests. What we see on the blood test is we can read how the liver is functioning and managing. We can also read the cholesterol levels. So they're the key things that I monitor for Morgie. And because her disease is so severe and because she does come and go with signs of sickness, we're actually monitoring this and tracking this on a 6-monthly basis. So we can see if her cholesterol goes up, we can see if her liver factors go up. She hasn't had normal factors since I've been managing her. We've been now managing this disease for 10 years and we're just basically stabilising it and stopping it from getting worse, but we haven't been able to reverse any of the disease completely. So diagnosis of disease can be done a number of ways. Firstly, we take blood tests. And often we'll do x-rays as well to help us understand what's going on. So the blood test tells us how the organs are functioning internally, but an x-ray can tell us if there's swelling or enlargements, where that enlargement's coming from, and help us cue into what might be going on. With diseases like fatty liver disease, you'll get very general liver changes and indications of liver failure on the blood tests, and you'll get things like swelling on the x-rays. But we might need to extend even further and take biopsies from the liver. And that can be really important because there can be a number of different things that will cause swelling of the liver as well as some changes in the blood, and that could mean some type of cancer as well. So therefore it is important to actually get a confirmation of diagnosis of exactly what's causing the liver failure, whether it's directly related to diet issues like as fatty liver, which is very common, or whether we've got something like a liver cancer going on. Birds with fatty liver disease are a high risk under anaesthetic. Because we need a functioning liver to allow for good recovery and to minimise the risk that the anaesthetic will lead to toxic side effects. So often what we do with these birds before we do any kind of surgery is we try to address the fatty liver and the diet issues as much as possible. If we can do that, they'll have a better functioning liver and there'll be a lower anaesthetic risk. They're often a high risk at bleeding as well because the liver produces the clotting factors that the blood requires to minimise sort of bleeding disorders. And so if we can fix that and reduce that, then that makes them a lower risk. That we often find when we do that too, the lumps reduce in size and become a more simple surgery. They never completely go away once they've formed, however. It does become a more emergency case, and sometimes we have to take risks if the lump has been so big that it's ulcerating and bleeding, because we don't want the bird to bleed to death or have issues simply because we've left the lump there. So it becomes a little bit of a dilemma if people have left these lumps for too long and not really understood what's going on. Okay, so this is Morgie's x-rays, and on Morgie's x-rays we can tell we've actually got a very large heart. You can see the heart shadow here. This is a lot larger than what the heart should be in this species of bird. We can also very, very clearly see the major blood vessels off here, and they look a little bit large as well. And that's a common concern that we've got, atherosclerosis, which is thickening of those arteries. So very similar to what happens in people, and it affects the blood flow. So that can cause a very serious blockage of flow of blood around the body. We've also got here quite a filling area. So with the heart here, the liver sits in this area here, and this is quite large, this liver. We can't quite see all the outlines, but I know that the liver's sitting here because it should sit just below the stomach, and this here is part of the stomach with all these little bits and grit inside there. So that's been pushed out of position. It's been pushed in this direction, and it's been pushed back from where it should sit. And the only thing that's going to do that is a very large liver sitting here. So I can tell that this liver is very large on this x-ray without actually seeing the full outline. We should have a black area here indicating where the air sacs are. So that's also an indication that the liver's sort of pushing tissue this way as well. So this is an x-ray here of a very similar species of bird, and we can see here we've got much more black area here where the lung capacity is, and you can see much more clearly the hourglass sort of appearance that's occurring. So this is the heart at the top, and this is the liver over the intestinal tract, and certainly we can see this gizzard here, which has all the grit. The part of the stomach with the grit is sitting over sort of the hip area where it should be sitting. The interesting thing here is we can see a microchip here. So this little line here is the x-ray of the microchip. This here is what we call the lateral view. So the lateral view is when the bird is lying on its side. The other view was when the bird was lying on its back. So that's the two views help us get a three-dimensional feel for what's going on. Again, we can see the heart sitting here, and you can compare to the last bird that we saw, very similar species. You see the heart is so much smaller, and you can't really see the full edge of the heart, but we can see it just here, and the liver is sitting just in here. So much, much smaller. We're actually seeing a bit of gap here. We're seeing that's where the air sac is sitting, whereas the previous bird, it was all filled.